While some menopausal symptoms can become less severe over time, there is one that's kind of tricky if you don't know what to look for. Here to offer a little clarity is Maddie Gresham. Welcome back.
Thank you for having me back.
Thank you for coming always. Now, we've discussed menopause and a number of symptoms in the past.
Yes.
But today we're actually going to focus on a condition that can greatly reduce the quality of life.
Yes.
Yeah, I'm going to let you say it because it's quite the word here.
It can't be a mouthful. So we wanted to talk today about genitourinary syndrome of menopause because I think it's something that is underdiagnosed and overlooked. Historically, we may just associate with this, and I'm going to be using anatomical terms such as normal and healthy, right? We used to just associate this as vaginal dryness, and women, I think, just think it's a normal part of aging, or they're embarrassed or uncomfortable bringing it up. But the tissue changes that can happen down below when we lose hormones and we're menopausal affect so much more and cause so much more than vaginal dryness.
Oh, wow. So I know there's like people put oils and things of that nature down there that aid in lubrication or making sure it's not as dry.
Yes.
How does that affect GSM?
Yeah, so genitourinary syndrome, menopause, GSM, what is happening is because of the lack of estrogens in male-type hormones, androgens, the tissues of the vagina, the vulva, and the bladder change. They become thinner, they're less elastic, they have less lubrication and sensation and blood flow. They lose their acidity, which is what helps to prevent urinary tract infections and vaginal infections. So moisturizers can help to moisturize the tissues, but it's not going to help those tissue changes revert. And to do that, we need to think of other therapies like a local estrogen therapy.
Okay. So, I mean, just listening to some of the things you're saying, I would be concerned. You know, we don't want every woman to be like, I'm a little dry. Oh, my goodness, do I need to look into this? Especially if they're in the ages of menopause. What are some of the risks associated? And at what point do they need to reach out to OBGYN?
Absolutely. So some of the risks that are associated is an increased risk of UTIs. And we know as we age, UTIs can be very severe. They can cause sepsis, they can cause death. So they actually did a study related to this condition, and they found that if all women on Medicare were offered vaginal estrogen, which can reduce UTI rate by 50%, we would save healthcare costs billions of dollars, $6 to $22 billion. So the risk is reduced quality of life, pain with intercourse. I'm itchy and uncomfortable. I can't sit down. I can't be intimate with my partner. I don't have desire anymore. I don't have arousal. I don't have pleasure. I'm up during the middle of the night urinating. I have more frequency because those estrogen receptors are not only within the vagina, but within the bladder too. So there are real risks, and there's numerous studies that show how negatively it can impact a woman's quality of life if they just try to deal with this without any help.
So let's talk treatments. I know you mentioned a therapy.
Yes. So when we think about hormone therapies, we have hormones that we can use systemically that go throughout our body. For this condition, we can use local therapy, which is wonderful because it's absorbed right where we place it, and there are no risks associated with it because it's not absorbed systemically. So any woman can use this safely. So if you've had a blood clot, if you have a history of breast cancer, we have numerous studies that show this is safe. There's different ways that we can treat it. We can use creams, there's inserts, there's rings that go inside of the vagina and stay in for 3 months. There's actually an oral medication that is approved as well. So there's numerous different treatment options that we can kind of use to approach it. And like you said, also on top of that, we can think about using moisturizers, but we really need hormones to fix the real root of the problem.
Yeah, and based off these symptoms, are there any other conditions that this can be confused with?
Yeah, so that's a great point, is when we are experiencing any discomfort down below, changes to our bladder function, it is important to see a doctor because there are some sort of skin conditions or urological or bladder conditions that may have similar symptoms. So it is always a great idea to see your healthcare provider so we can look and make sure we're not missing anything aside from hormonal changes.
Absolutely. And of course, we want people to reach out to the experts at Carle Health.
Absolutely.
So how can they get in contact with your office?
Absolutely. So our office is located on North Knoxville, and you can give our office number a call. We're accepting new patients. I'm happy to see you, and we have a great team to take care of you.
Absolutely. Well, as always, it has been a pleasure.
Thank you. Thanks for having me back.
Thanks for coming.